Next, fentanyl. Also known as sublimaze. It is also a narcotic. Opioid. Its mechanism of action, analgesia. And sedation. Through binding with opiate receptors. It also has an anesthetic effect that goes along with the sedation. This is a little bit stronger. Can be used for small procedures, such things like that. Contraindications to fentanyl would be our indications for fentanyl. I apologize. Indications: moderate to severe pain. Let's do that in green. Makes a little more sense that way. Indications, that's why we want to give it. To severe, moderate to severe pain, and as anesthetic. One of the times you might consider doing this or giving fentanyl, moderate to severe pain, think of, or you're looking for a sedation or an anesthetic effect, SVT cardioversion would be a decent time. This is a very short-acting medication, so it's very strong, very effective, but also very short-acting. Might be a good one to consider when cardioversion. Our dosing, 25 to 100 micrograms. That is micrograms, mcg. This will be given IV, IO, IM, IN, intranasally, and sub-Q. Plenty of routes of administration, of course, some such as the IM and the IN and sub-Q are a little slower on absorption, and they may help it last just a touch longer due to that. So our contraindications, of course, hypersensitivity or allergy to medication. Oop. Seems silly to write it. So allergy or hypersensitivity. Our adverse reactions: nausea, vomiting, respiratory depression, cramps, and chest wall rigidity. That's a different one. Cramps, chest wall rigidity. Chest wall rigidity. Basically what that means is exactly what it says. Your chest wall becomes rigid. While you're breathing, you breathe in, breathe out, chest opens, expands, intercostal muscles lift and open the ribs, creating a larger space, negative space within the chest, drawing air in. If your chest wall becomes rigid, what's that going to do to your respiratory? Severely limited. Make them diaphragm breathing or, or worse, make them stop. Again, respiratory depression, chest wall rigidity. If you push too much too fast, this can happen. And it's pretty ugly when it does. However, as said before, fentanyl is a very short-acting medication, and it also is reversible through Narcan. We'll talk about Narcan in just a moment. But these are definitely things you want to consider when pushing fentanyl in the heat of the moment. You don't want to just slam it. You want to give a, not necessarily a slow push, but you want to be mindful of how fast you are pushing the medication. Of course, always monitor your patient when given a medication that does respiratory depression, nausea, vomiting. Now, let's also think about this as a adverse effect or adverse reaction side effect is anesthetic and sedation. Altered level of consciousness, or altered mental status. You can change your mental status. You can make them unresponsive if you give too much, overdose. Same with any other narcotic. Interactions. Fentanyl does not have a noted adverse effect on blood pressure. It is becoming a favorite frontline drug along with morphine with chest pain. It is definitely one you want to check your standing orders for your local service or who you're going to be riding with and see if it's in there and if it's available as a standing order or if it's a call-in order. If your patient is having hypotension and you're still worried about pain, fentanyl is a possibility. Again, check with local medical direction, check with local standing orders, and when in doubt, always call medical control.